I'm Dr. Gregory Freund, and I teach MCB 458, Basic Human Pathology. I myself am a practicing cytopathologist at Carle Foundation Hospital, who's taught this course for a number of years and enjoys very much working with undergraduate students related to learn the aspects of pathology.
When is your course typically offered? Fall, spring, summer?
Our course is typically offered in the spring.
Can you give me a brief overview of what is covered in your course and what are the learning goals?
Basic human pathology covers mechanisms of disease. And interestingly, given the cornucopia of pathogens, disease processes that you can experience, the body's response is often very limited in what we see phenotypically. Therefore, we're going to sort of drill down on aspects of the human condition, especially sickness symptoms, where we can begin to understand that regardless of what the disease may be initially, the endpoint often looks the same. And understanding how a disease comes about gives you insight into what the cause of the disease is.
What is the format of your course?
The format of the course is a hybrid between case-based learning and lecture. In the lectures, we go over the first 5 to 6 chapters of Robin's basic pathology book, and it's pretty much verbatim from that textbook. The cases, on the other hand, are student presented. So students are in groups. They've got to pick their own case from the New England Journal. It's up to them. Hopefully they tie one of these cases into what the lecture material is about. And they present it as if they were on clinical rounds. We add in, they also generate questions within the lecture for sort of fun and games. Sort of it's a formative aspect, and we and the teams all vie for completing those, and we have a little scoreboard that we keep track of how the teams are doing. But really, the essence of it is sort of delving a little bit more deeper into a clinical presentation, and also beginning to understand the pathology and mechanism. Now, what's exciting about the New England Journal cases is that the New England Journal cases usually come to New England Journal because they've been in other hospitals where the diagnosis was missed. And our sort of job and role is to understand how those cases were initially missed by the clinicians, and seeing how our understanding of pathology could have enabled us, if we were in that position, to make the right choices and order the right tests at the right time.
How are students in your course graded? Exams, quizzes, homework?
They are evaluated based on their presentation and 3 multiple choice exams. The breakdown is on the website.
Historically, which portion of the grade breakdown do students struggle most with?
I think in general it's probably the multiple choice, but we try to engage. We hope that we can get students actually to write some of the questions so they can answer their own questions on the multiple choice exams. The multiple choice is designed to really jive with the textbook, and if you've read the textbook and understand what's in the textbook, you should not have any real challenge in grasping the material. We're not trying to throw anyone any curveballs.
That's cool. So you give students the chance to submit their own question and you choose?
Absolutely.
Cool. Are there points associated with attendance?
Only on the case days. I think that's an important thing that I like to drill down on, because again, this is designed a little bit like a medical school curriculum. Therefore, lecture is not required. So really, you don't have to show up, and it's not a requirement. But the learning that you're going to do requires you in that period of time to, aggressively look at the textbook. If that's not the kind of learning style you have, again, this might not be the course for you.
Are there any required textbooks for this course?
The Robbins textbook, and the latest edition is out, which is all on the website.
Do you provide students with PowerPoint slides or lecture outlines before class?
Yes, those are all available on the website prior to class.
What kind of background knowledge do I need to take this course?
That is all on the website, but it's usually seen as a bit of a capstone course, so it's juniors and seniors in general.
How do topics covered in your course apply to current research or medical or scientific advancements?
This course is especially focused on pathology, and pathology is the cornerstone of sort of laboratory medicine within not only a research system, but also in hospital systems. So every blood test, every tissue test runs through pathology. So understanding those biometrics really help one understand both what is health, what is disease, and how health can change into disease.
What opportunities do you provide outside of class for students to ask questions or get assistance?
We don't have official office hours, but my assistant, Jackie Newman, is available to schedule me, and I very much enjoy meeting with students who want to meet. And we often have interactions based on the student's interest in not only the course, but also especially things related to medical school. Because in my role as an interim associate dean of academic clinical affairs, that's sort of what I do, work on the curriculum of medical school.
Okay. Is there anything else that you would like to tell us about your course?
I think it's an exciting opportunity over the many years we've had it. It's fairly popular. And I think the aspect that is most enjoyable to the student is the case presentations, because starting especially in the professional schools like medicine or vet school, those types of interactions become the sort of standard way physicians learn and physicians are taught. I think one of the things that's sometimes difficult for students to sort of engage with is the lecture format. We may do some modifications of that, but part of the process is self-actualized learning, and that a individual rewriting a textbook through PowerPoints or help better defining the salient points that are already bolded in the textbook or in colored boxes makes is sort of what's expected sort of at the next level. And therefore many modern educational formats in medicine, of course, rely now on the case and students using the time for their best served processes of how they want to, sitting in the lecture and listening to sort of a deeper dive into the material, or staying at home or the library and just concentrating on the fundamental knowledge that will be tested on.
Great, thank you.